Now, we are going to talk about hemostasis. So, hemostasis. Okay, when we say hemostasis, we mean blood clotting. Okay, so we have all experienced a cut or a boo-boo. Okay, paper cut, all the way up to major trauma for some of us. Okay, so hemostasis, we've got 5 steps. Okay, we're going to make that blood clot. We're going to repair that broken vessel. We're going to restore function. Okay, we're going to limit our blood loss as well. So we've got vascular spasm, platelet plug formation, coagulation, clot retraction, and thrombolysis. Okay, I got some good words, good science words here. So, step number 1, vascular spasm. Okay. As soon as you damage your blood vessel, we're immediately going to go into vascular spasms. Okay. One of the things that this does, it reduces how much blood you're going to lose. Because how are we going to spasm? We're going to vasoconstrict. Okay. We are also going to increase the blood pressure in that vessel to kind of help with the constriction. These are both going to decrease the blood vessel diameter. Okay. So the tissue is going to press on the vessel. We're going to also vasoconstrict the vessel. We are going to limit as much as possible how much blood we are losing. So in our image, we have cut our vessel. We are actively leaking blood. Okay. You can see our little arrows are pointing inward, so we're going to squeeze this vessel. Okay. The vessel itself is going to constrict, and we have now minimized that blood loss. Notice we're still bleeding, so that's not 100% effective, so we can't just stop at step number 1, but we have greatly reduced how much blood we are losing. Okay. We are going to need some help to further along this process. We're going to have some platelets show up. Okay. We are going to have those platelets release something called serotonin. Okay. Serotonin is going to further trigger the tissue and the vessel to spasm, to continue to minimize this blood loss, and this is one of our examples of positive feedback. Okay, so we are going to keep recruiting platelets. Okay, we're going to keep releasing serotonin. We're going to continue the vasoconstriction, the vascular spasms. We're going to continue to minimize that blood loss until we can finish creating the blood clot and fully repairing that vessel. Okay, so we've vasoconstricted, we've done our spasms, we are minimizing blood loss to the best of our ability. Now we need to start plugging up that hole, the injury to the vessel itself. Okay, and that's where our platelet plug comes in. So the nice thing is that the platelets themselves are really only going to stick to the injured vessel itself. Okay, and we're going to make a patch. All right, so if you look at our picture, we've got a little gap here. Okay, and we need to fill the gap. And so you can see that we are starting to send out signals, and we are going to plug up that gap. Okay, so these little signals, we call them von Willebrand factor. Right, it's a nice little science term to remember. This is what's going to recruit those platelets and help them stick. And you notice we'll just make a giant pile of them. We'll overdo it just a little bit. But you'd rather overdo it a little bit than underdo it and still have a gap. Okay? So normally those platelets would just bounce right off of your blood vessels. We don't normally want our platelets to stick to the vessels themselves because we don't want to make clots unnecessarily. But this von Willebrand factor is what kind of makes this area sticky. Okay, it helps make them sticky, it helps recruit the platelets, and ultimately the platelets will stick to the site of the wound. Okay. And again, the whole time we're still doing the positive feedback, we're still recruiting more platelets, we're still releasing serotonin. Just interesting side note that aspirin inhibits the action of platelets, so a lot of times you will hear aspirin described as being an anticoagulant. So we are trying, an aspirin would inhibit the coagulation of blood. Okay, speaking of coagulation, okay, now we're going to make some glue. We're going to make some body glue. We're going to bind platelets. We're going to bind new endothelial cells. We're going to bind other formed elements together. We're going to make this giant web, which is honestly pretty cool looking. Okay, so these are really microscopic examples of what this looks like. Okay, so this is coagulation by itself. It is a quote-unquote cascade of events. What does that mean? That means there are a lot of steps and there are various factors, 1 through 10. Okay, there are a lot of different parts to coagulation. We're going to keep it simple. You're welcome. Okay, you need to know fibrin. Okay, so we are going to do all of these steps because we are trying to activate fibrin. Okay, we're going to get to fibrin, promise. We are going to also need prothrombin, okay, which allows a clot to form. Okay. Thrombin is going to help convert fibrinogen into fibrin, which again, we just said we're looking to activate fibrin. This is how we're going to do it. So, here we go. Prothrombin activator is formed. What do we think prothrombin activator is going to do? Hopefully it will not shock you to learn that we are in effect going to activate something. So we're going to activate the conversion of prothrombin to thrombin. Okay. Thrombin is an enzyme. This is one time where your enzyme is not going to end in ase. It's not thrombinase. It's just thrombin. Okay. Thrombin then catalyzes the creation of a fibrin mesh. So that's where the fibrin comes in. Okay. We're going to make this mesh, this spider web. Okay. This is going to trap red blood cells, white blood cells, platelets. We're going to seal the wound so we can start doing vessel repair. Now, you're going to need a little bit of help, and the help might come in unlikely places. You need vitamin K, and you need calcium to make all this work. Okay. So without going into too much detail, remember we said coagulation was a multi-step process. Some of the clotting factors that we use require vitamin K to be effective, and some of the cofactors used in the process need calcium. So if you don't have enough calcium and or enough vitamin K, you could negatively affect how well your body coagulates blood. Okay, so we've plugged up the hole. We've plugged it up. Okay. Now we have to get rid of our clot. So within 3-ish to 5-ish minutes, your clot has stabilized and the platelets are going to contract. When they contract, they're going to pull on that fibrin mesh that we just made. And so we're going to start to, so here's our clot. We're going to basically kind of pull this out. So imagine if you kind of pulled up. So as you pull up, the two sides of your wound get pulled together. Yeah. Wound edges brought closer together. Okay. So now this is much easier to fill in the gap versus, so imagine this wasn't here and you'd have all this empty space down here and we'd have to fill all that in. That'd be a little bit harder to do. So when we remove that clot, we pull the edges of the broken vessel closer together, and then we have to go in and basically kind of sew it up. We're going to need to make some new tissue there. Now, we remove the clot from the wound itself, which is great, but we're also going to need to get rid of the clot itself, because what we don't want to happen, okay, is once this clot is free, it's now termed a thrombus. We don't really want that thrombus to go, I don't know, stick in your lung and cause a pulmonary embolism and kill you, or get stuck in one of your deep veins and get a DVT and kill you that way. We don't want any of that. Okay, that'd be bad. So we are going to take enzymes and other proteins and we're going to break down that clot, okay, back into its original pieces. So this wouldn't go on and then cause further damage. We don't want that. Okay. It takes about it takes a little bit more than 2 days, because the process begins within 2 days, but it will continue until the clot is fully dissolved. So really kind of depends on how big the clot is. Okay, So we got our big picture. We did our vascular spasm. We did vasoconstriction. We reduced blood loss. We did our platelet plug. We did coagulation, and we did the quick and dirty of coagulation. We just made our fibrin mesh. Then we have to remove our clot and pull our two sides of our wound together, and we'll do tissue repair there, and then we'll get rid of our clot. Okay. Now, we do have to regulate this because we don't want to just go and make clots for fun. Okay, so clots can be very dangerous. They can block blood vessels, cut off oxygen supply to major organs and tissues. We don't want any of that. Okay. So endothelial cells and certain hepatocytes, okay, so certain liver cells, produce anticoagulants, which inhibit coagulation. Okay. You also have other cells. Okay, so heparin, okay, or antithrombin, whatever term you prefer, is produced by basophils. Okay. So if you remember our discussion covering leukocytes, we said basophils were our least populous white blood cell. Okay. And this is just one of the effects, is they can release the heparin, the anticoagulant. Okay. We did mention aspirin as being an anticoagulant, but we also have the heparin. Warfarin, heparin and warfarin are also commercially available to prevent undesired clots. A lot of times these will be called blood thinners instead, which is a little bit of a misnomer. They don't exactly thin your blood, they just inhibit the ability to clot. So it's kind of a popular term to call them blood thinners, but it's not a super accurate description of how they function.